I'm Dr. Filippos Geogopoulos. I'm a consultant gastroenterologist and interventional endoscopist.
Recently I started having heartburn frequently, and I have heard it could be Gastroesophageal Reflux disease. Could you please give me some information about it?
Well, when you swallow your food, it passes down your throat and through your esophagus into your stomach. At the lower part of our chest, exactly at the point where the esophagus is joined to the stomach, there is a muscle valve that should stay closed at all times, and this muscle valve regulates the passage of the food from the esophagus into the stomach. The name of this valve is lower esophageal sphincter. So the backward movement of stomach fluid as well as food particles is called reflux. The lining of the stomach produces acid at all times, but especially during digestion. So if this particular muscle valve is much more frequently relaxed than normal, stomach fluid, and particularly acid as well as food material, can regurgitate up into the stomach, irritates the lining of the stomach, and as a result of that you may have this unpleasant feeling of heartburn and maybe some degree of inflammation. The lining of the esophagus is not very resistant to acid, and that's why as soon as it gets irritated you have this unpleasant feeling of heartburn.
Dr. Philip, is it treatable?
After having proper consultation by a consultant gastroenterologist, you should have a full physical examination first. During this visit, it will be decided whether you're going to have an upper GI endoscopy. Upper GI endoscopy is this telescope tube test in which we examine the lining of your esophagus as well as the lining of your stomach. With this test, we can see whether there is any degree of inflammation, what we call esophagitis, or any stricture, and decide about the definite, most of the times, medical treatment. Nowadays, all these telescope tube tests that they're called endoscopies can be done under sedation, so the patient is put to sleep for a very short period of time, no more than 5 to 10 minutes, and they make them completely painless. With the latest endoscopy technology that we use in Al Hospital, which is NBI high definition endoscopy, we're able to examine in detail the lining of esophagus or stomach and decide what's going to be the best treatment for our patient. And most of the time, the definite treatment is going to be tablets, which are called proton pump inhibitors, that patients will take for a shorter or longer period of time depending on the severity of his symptoms as well as the finding.
Dr. Philip, is there something I can do myself to prevent it from happening?
Well, lifestyle modification may have a complementary role to pharmaceutical treatment. For example, we know that patients that they consume lots of alcohol, fizzy drinks, lots of coffee, tea, they eat lots of fatty food, may have very frequently gastroesophageal reflux problems. In addition to that, smokers, obese men may have very frequently heartburn. So if we're able to eliminate all these factors, then we may have a substantial clinical improvement which could lead not to take so frequently medicines for the gastroesophageal reflux disease. So my suggestion will be to lose some weight, stop drinking fizzy drinks, coffee, tea, and avoid fatty food as much as possible, and all these could lead to a definite improvement of your symptoms.
Can it be treated surgically?
On difficult and very selected cases, the surgical treatment could be an option. Traditionally, these operations were done with an open surgery, but nowadays this treatment can be done either laparoscopically or endoscopically. But I'm sure that a specialist laparoscopic surgeon can give you more information about this.